Hi there, if you've just joined us, you're very welcome to today's webinar. We will be starting in about 1 minute, so we'll just give 1 more minute for people to join us. Thank you. Okay, so I think it's just gone 12 o'clock, so I think we will get started. So you're very welcome to today's webinar. My name is Michelle Leach and I'm Professor in Radiation Therapy here at Trinity College Dublin in Ireland. So I'm delighted to welcome you to today's webinar. So if you recall, we're running these webinars for CPD purposes for radiation oncology professionals. And today's webinar is all about education, which makes it a nice change from previous ones that we've had. If you have questions for the speaker today, can I ask that you use the Q&A function, please? I think the chat on webinars doesn't work very well, so if you use Q&A, and of course we definitely welcome that you ask any questions that you have. So with that, I'll introduce today's speaker. I'm delighted to introduce my colleague, Dr. Elizabeth Forde. Liz is a radiation therapist and assistant professor at Trinity College here in Dublin. She has over 20 years of international experience in clinical and academic settings. Her research interests are in treatment planning, adaptive radiotherapy, radiomics, and normal tissue damage. In addition to her role here at Trinity, she's also involved in the ESTRO School, the Radiation Therapist Committee, and she is a member of the ESTRO Board of Directors. And here in our school, she is also a School of Medicine champion for the inclusive curriculum. So she is very well placed to deliver today's webinar on advancing equity in radiation therapy education through universal design for learning. So I'm going to stop there, and Liz, I'm going to hand over to you now. Thanks very much.
Great, wonderful. Thank you for the introduction, Michelle. So you can see the title of my webinar today, so Advancing Equity in Radiation Therapy Education. So this is something that we know a lot about in other disciplines and even in medicine in general, but specifically in radiation therapy, it's something that perhaps is discussed a little bit less. So first of all, just to start off with just some brief definitions, looking at really the difference between what is equality and what is equity. So equality is where we provide the same resources for everybody, but equity, on the other hand, is actually where we tailor the resources that we provide to individual students with the hopes that they will achieve an equal outcome for all of the students. So an inclusive curriculum then is one in which all students, regardless of their background, personal circumstance, or learning abilities, or even have different kind of cultural backgrounds and things like that. So the inclusive curriculum provides students with an equal opportunity to engage fully in their studies and achieve their learning goals. Now, how we do that at Trinity College in Dublin is that we embrace an inclusive curriculum which is underpinned by the educational framework or a concept, universal design for learning. So as I mentioned, universal design for learning is an educational framework which is underpinned by 3 pillars. One is providing students with multiple means of representation. Second is providing students with multiple means of action and expression. And then finally, providing students with multiple means of engagement with the material. Now, within the School of Medicine at Trinity College, myself as a school champion and also my co-champion, Dr. Julie Broderick, we felt anecdotally, just discussing with colleagues, that there was a lack of the concept of UDL amongst our peers. We felt also that there was confusion regarding what is meant by teaching inclusion healthcare and teaching in an inclusive way. So just an example there, when we discussed with colleagues, they said, oh no, I'm quite inclusive in what I teach. And we make sure that, as an example from radiation therapy, we make sure that we give examples of maybe radiodermatitis on different skin colors and things like that. And that is, teaching inclusion healthcare, but it's not really teaching specifically in an inclusive way. So it's the methods of what we teach and assess compared to the content of what we're teaching. And then finally, we felt that there was uncertainty regarding the impact of state regulatory bodies. And this is specifically true when there were concerns around assessment design. So if you remember, one of the 3 pillars of UDL is providing students with multiple means of action and expression. And that's really where we kind of match up the assessment strategies with the UDL principles. And we felt that, within radiation therapy and also medicine, from a more wider curriculum, we felt that sometimes we were a little bit limited in the flexibility of what we could do because of, all of our programs at Trinity, obviously similar to other universities around the world, are kind of regulated by an external state body. So that sort of raised some concerns there about the flexibility of what we could actually do. So to get a better understanding, as opposed to these kind of tea room chats, Julie and myself, along with some students within the school, surveyed the academic staff. So the aim of this survey was to investigate the perceptions, needs, and current practices of inclusive teaching and learning methods within the school. We conducted a survey of all academic staff who contributed to the education of students within the school, to seek their understanding of what an inclusive curriculum actually entails, and to ascertain as well how they currently embed, or perhaps how they're not embedding, inclusive practices within their teaching. So we have 1,300 staff on the academic email list. We got 56 respondents, which was, I'll be honest, disappointingly low. The majority of the people that responded were actually, quite experienced in terms of their time spent in their current position. And over 2/3 of them, or approximately 2/3 of them, were module coordinators. So they were in a position that were actually, able to make changes within their modules. So despite the relative experience of the cohort, that being said, approximately 1 in 5 of them only 1 in 5 felt that they were very familiar with the concepts of UDL. And in fact, 2/3 had no knowledge of UDL whatsoever. So asking staff then, what did they feel were the barriers? The top 3 responses in terms of barriers for implementing UDL and changing to more inclusive teaching strategies was simply a lack of time. And I think there's no surprises there. I think if you do any survey on any topic and you ask what is the barrier, time is typically the one that comes out on top. Lack of interest and motivation was an interesting one. And I think really when we go a little bit deeper, we sort of start to appreciate that we need to have kind of champions, obviously, but we need to have we need to have sort of support from key stakeholders within the school. So at a higher level, and it needs to trickle throughout. And then finally, of course, lack of knowledge. And this is something that we've really tried to help with, and I'll go through some examples later on. So of course, then focusing not so much just on barriers, but facilitators, what can be done to support our staff in becoming more inclusive in their educational strategies. So providing practical information, guidelines, and kind of webinars and things like that is a really simple tool. There was a call for a combination of short training courses and also just even email reminders to generally promote awareness. and additionally stress the need to change attitudes and integrate this within the curriculum review. So again, within our school and certainly our discipline here at Trinity, we do annual curriculum reviews, and having a look at our teaching practices and our assessment practices under the lens of UDL is something that we have been doing routinely now for a number of years. Now, if you're wanting something a little bit more concrete, this is a publication that I think is particularly helpful. It really is very practical. It goes through 12 tips for designing an inclusive curriculum, and it is specific to medical education. So Carl Luke's 12 top tips, I'm just going to go through them very quickly here. First of all, embed inclusive design from the start. So it's quite difficult, or it can seem quite a big task to sort of retrofit and retro-correct your curriculum. But if you are in the lucky opportunity, if you're in the lucky position of designing a course or a module from the start, it's a really wonderful opportunity to do so in a really inclusive way. Secondly, defining clear and achievable learning outcomes. I think this is something that most educators are well versed in now and will do routinely. So hopefully everybody here is already doing that. Secondly, diversify the curriculum. And in fact, this is really an interesting point as well. And it's something that at college-wide level, actually, the conversation is continuing about decolonizing the curriculum. And that kind of goes back to providing multiple means of representation. Co-design with learners. This is something that I really do try and do with my students, and they have specifically fed back to me that they like that because they feel that, content can be tailored towards their needs. Presenting diverse voices and perspectives. Again, I am the module coordinator for treatment planning in our undergraduate module, and I am the sole lecturer. So I was a little bit concerned that it was my voice and only my voice that the students were hearing. And so for that reason, I invited several other academics to feed through in additional material that I provide. And I'll give you an example of that later on. And review the timetable and delivery. Again, this is something that links back very much with, co-design for learners and sort of asking students their opinions. This is something that our head of discipline, Professor Laura Marignol, has particularly embraced, whereby we recognize challenges that are facing students these days. We have the student population is more and more diverse, and they have a lot of responsibilities that extend beyond their academic work. And we need to provide them some time within their timetables to accommodate that and to facilitate that. And also, even for those students that might not have a particularly long commute, or they might not have a job or anything like that, and you might think that they're quite a simple case, even just providing some breathing space in the timetable can really help students digest the material that they are receiving. Moving on then, so design opportunities for cooperative learning. So lots of sort of engagement within the classroom and peer teaching opportunities. Consider effective teaching strategies. And this is where, again, we've really sort of tried to diversify the methods of delivery and try to be more innovative in how we teach our students. Offer multiple strategies to present information. And again, I'm going to go through some specific examples of that later on. Likewise, technology, providing flexible opportunities for assessment and feedback. Again, I've got some examples coming, so stay tuned. But finally, evaluating the curricula using an inclusive design checklist. And this is something that is available online. There are a number of different tools that you can download yourself and just really do a quick kind of health check on your curricula to make sure that it is inclusive. So I think I was teasing you a lot there saying, I've got examples coming. So why don't we go through some of these examples now, just looking at the work that I've done within my modules and also that of my colleagues in radiation therapy. So first of all, just by way of background, accessible technologies are the systems that we as educators use to provide students access to this accessible content. So at Trinity College, we use the virtual learning environment Blackboard Learn. Now within that, so accessible educational material then is either print or technology-based educational material that is designed or enhanced to make that material usable for all learners. And accessible formats provide this same information in alternative ways, which will then break existing barriers. So Blackboard Ally is a complement to the main virtual learning environment, which allows students to download these accessible formats. And it also allows us as educators to measure the accessibility of the materials provided. So Blackboard Ally automatically scans the content and will perform a series of steps then to make the material more accessible. So it can generate alternative formats for the students to download. It can provide accessibility scores, which is really important for us as educators to understand the quality, the accessibility of the material that we're providing. And that gives us feedback then to improve the accessibility score. And then it checks scores against sort of international accessibility standards. So within our department, we decided to do, as I said, a bit of a health check, and we did an accessibility audit. So the aim of this audit was to quantify the accessibility scores, sorry, to quantify the accessibility of the teaching material provided within our discipline, and it's really importantly then to highlight areas for improvement. So all modules coordinated by staff within the discipline were included. Accessibility scores were determined by the severity of issues identified for each item, and issues are flagged as either severe, major, or minor per item. And then the frequency of issues result in an overall score. So this is a tool that's part of the standard Blackboard Learn package. So you can see here a low score is 0 to 36%, and then it goes on for a little bit better and then all the way up to perfect. So within our discipline, we had 32 undergraduate modules were included. The mean accessibility score was 63%. The postgraduate programs, the 10 modules that were included in the audit there performed better than our undergraduate program. And just again, you know, if you're not aware, our postgraduate program is delivered completely online. So it's probably a little bit more innovative, I suppose, in how we can deliver the material. But just two examples here of two modules, one that performed quite poorly and one that was much better anyway. So this first module here is a 5-credit module. So that explains the big difference in the amount of documents that were provided to the students. But we've had the overall accessibility score was 24%, most of that being contributed as a result of a severe issue being identified. Conversely, no severe issues, and approximately the same kind of major issues had a big difference though in the overall accessibility score of the two modules. So the common issues though that we saw across all modules within the program was a lack of language set, poor contrast of the material provided, and also documents being untagged, which is considered a major issue. Most severe issues were identified because the PDF was a scanned PDF, and then that lacked the optical character definition, which impacts on the screen reader's ability to use the material. So the impact of this and these issues on the student experience: untagged documents impact on students' learning experience, in particular those who rely, as I said, on screen reader software. But even without the need to have screen reader software, poor contrast really just does impact all students' ability to comfortably engage with the material. So what else can be done? So we've identified some issues, but we need to find some solutions. A really simple tool, if in case, I'm sure many people are already aware, but in case you're not, checking accessibility can be done within PowerPoint, even, sort of prior to uploading onto the virtual learning environment. So it's just going into the tools and having a look at check accessibility. It then gives you a list of errors. Alternative text, I know certainly for my my lecture slides, it is typically the culprit. So missing alternative text in images on the screen then also impacts on screen readers' ability to kind of work its way through the document. Missing slide titles, ordering when you've got multiple text boxes and things like that within one screen, checking the ordering of that. Duplicate slide title as well is something that can be confusing for students and screen reader software. And luckily as well, they give you this intelligent solutions. So they have suggested alternative text for 22 of the slides in this example out of 133. So this is, again, what it looks like. So, you just say edit alt text, and then you can just type your own description, or you can mark it as decorative or anything like that. But that does have a big impact on the accessibility score. So improving accessibility score here, uploading a PDF format of your lecture slides notoriously will give you, if that PDF is untagged, the screen reader software and students that use that, then an untagged document is difficult because it's not arranged in a hierarchical fashion. Now, that exact same lecture slide, when it was converted or uploaded as a PowerPoint presentation rather than an untagged PDF, it raised the accessibility score to 66%. And then when I went through and added alternative text, not to all of the images, but just even some of the images, that improved the score up to 77%. Now, when we discovered this sort of stuff as a discipline, we weren't starting modules from scratch. We had, existing material that we had been using, and, they're kind of lengthy lectures, as you can imagine. So the idea of telling staff to go back and fixing everything, it takes a considerable amount of time. So the philosophy that we have adopted over the years is simply to improve each year on your, current baseline. So if you've got an accessibility score at 66% this year, fix what you can, and then over, a series of, hopefully 1 or 2 years, well, then you will be up at that perfect score. The other thing as well that we have started doing in our department is, releasing material to students in advance. A day or two in advance is really, really important for some students. But also as well, releasing the content, I mentioned, in multiple formats. So some students prefer, an untagged PDF compared to a PowerPoint presentation, which might appear to have a higher accessibility score. But that's simply because of the technologies that student is using, and they prefer, some students just because they're using Macs or tablets or something like that. So PDF works better for them. So again, going back to the difference between quality and equity in education, instead of providing everybody with a PowerPoint because it seems like it's the better solution, providing students with a choice of either a PDF or a PowerPoint really captures that equity, and students then can choose which method suits their needs. So this is an example again of, this comes now from our postgraduate program. So providing multiple means of engagement by uploading varied file formats. So I've mentioned already a lot about PDFs and PowerPoints, but as well, what we do on our postgraduate program, because it is really designed, it is delivered entirely online, and it needs to be designed for online learning. Well, then we provide the PowerPoint, we provide the presentations, as a recorded kind of MP4 file. We also provide the PDF of that presentation, and then we also provide an MP3 file. So the students can listen either kind of in a podcast format and follow along at their own pace, or they can get the full sort of suite through the MP4 webinar kind of approach, the recorded lecture approach. Likewise as well, again, an example from our postgraduate program, but we also use eTivities across our undergraduate programs. Supporting students and supporting multiple means of expression by letting students know that they can upload a range of file formats. So we obviously provide content in a range of different ways, but likewise, it's equally important to make sure that students are aware that they can do the same with us. So they can, they don't have to be limited to typing. They can, upload an MP3 or an MP4 and things like that. And that can then be used on the online discussion boards, blogs that we do, reflective journals and things like that. And I think, the reflective journaling is actually a really nice example to show, because I know myself, it can be difficult unless you're you had a journal when you were younger. It can seem difficult sometimes to write a reflection, but students sometimes, and myself, we feel much freer to reflect if, through the spoken word. So being shown how to do that and shown that, the technology does facilitate multiple means of expression will help students then that way. Again, now, continually trying to link back to the theory of UDL. So using multimedia supports the multiple means of representation. So providing videos, podcasts, and images as an example. As I mentioned, I teach predominantly in treatment planning, which is a very practical subject. So we obviously cover some theory, but then the majority of the teaching hours is dedicated to students, working on the treatment planning system that we have at the university and creating clinically acceptable plans. So of course, then, it's really, really helpful to students to be able to take that experience with them, outside the timetabled sessions and to use it in their own private study. So for each of the cases that we will plan together in class and that the students will plan themselves, I also then record a video demonstration of me working through that solution and make that available to students after the class. I mentioned podcasts earlier, and again, this was within my own module, just because I was aware that I was the sole lecturer, and I was really conscious that it wasn't really kind of multiple means of representation when it was only my voice that the students were hearing and my opinion. So for that reason, I brought out a kind of podcast series where I invited other academics within our discipline to join me, and we read through, we kind of focused on a peer-reviewed journal, and we sort of did a critical analysis of that publication. So that served multiple purposes, actually. It gave students a different way of engaging with the material, and it also gave students a really sort of lived example of what we expect when we're asking for critical analysis of the evidence base. Soliciting feedback from students. So again, this is a two-way street. It's not just about us providing multiple means to the students, but making sure that they're aware that they can, use multiple means to feedback to us. So annually, at the end of every module, we always solicit feedback from our students. Typically, that's done using, kind of anonymous forms and things like that, quite traditional methods. But as well, though, we've also used Video Ask, in which students can choose to either reply using video, audio, or a text. So, I mean, obviously, if it's a text, well, then the feedback remains anonymous. But if they're using video and audio, it's not. But that being said, when students are, happy to provide kind of really constructive feedback for us, anonymity doesn't really seem to matter so much. This is something that I particularly enjoy using a lot in my classes is the TCD polls, which is powered by Vvox. So I'm sure, there are a lot of other different tools that you can use, Padlet and things like that. But this one here is where students scan a QR code, and then they can either submit questions throughout the class, or alternatively, I can have a question already ready to go, and they just scan the QR code and then they answer the question. And you can produce word clouds and things like that of, how people are feeling about, the case today, or, if they need help or anything like that. And it's a really quick way just to test, do a quick knowledge test before you move on through the content. So conclusions then from our department at Trinity. So far, the work that we've focused on, the kind of audits that we've done, the surveys that we've done, as I said, even just having these tea room chats, it really has raised awareness of regarding the accessibility of the teaching material that staff provide. It has identified areas of improvement. It's encouraged staff to become more innovative as well. And we've seen really wonderful strides being taken in recent years about staff doing, different things that the students have responded really well to. And finally, it's highlighted to the students our continued commitment to their learning experience. So we have departmental meetings with our students twice a year, and we use those meetings as an opportunity as well as kind of, our daily interactions, just to remind students of the efforts that we put in as academics, and ask, again, for feedback from them about the materials that we're providing. So it's not siloed to our department in radiation therapy. This has actually come from a college-wide initiative at Trinity. So this has really come from, as I said, the Trinity Inclusive Curriculum Project. So we've already gone through what exactly an inclusive curriculum is, but you can see there the goals listed. And really it is about kind of embedding principles of inclusion in all aspects of the academic cycle. And this is something that that the university on a whole has really, really worked towards over the recent years. They've got a wonderful amount of resources available on their website. So obviously just about the project in general. In addition to the School Champion project, which is now kind of the staff partners, we also have a student partner program. And, I mentioned earlier the importance of working with and alongside your students in this respect. You can't make assumptions about what you think they need. You need to ask themselves what they actually need. So the student partner program has been invaluable. They've got an advisory board, obviously, inclusive curriculum tips and resources. In addition, we're lucky at Trinity that all academics have access to this 5-credit module. So it's professional learning and inclusive practices, and it goes through all of the theory. But again, when I did this module alongside my colleagues and the other school champions, we really felt that it was important, first of all, to acknowledge to our peers and our colleagues the good work that we're already doing. I think a lot of these things, that I gave the example of clearly defined learning outcomes. A lot of these things you are actually probably doing without kind of formalizing it and kind of formally recognizing it. So that's very important. But as well, it can be really big to ask students, to ask staff to change everything. So again, just so you don't scare them off the entire idea, just focusing on some quick wins and, identifying small changes that can make a big difference. So the resources available, we've got obviously, examples of how exactly to make your materials more accessible, looking at, the standard Microsoft Office stuff. Support within the virtual learning environment of Blackboard. Even, we're quite active on social media within Trinity and within our department. So making sure that even when we're, producing content for social media, that's done in an accessible and inclusive way. And we've got Trinity Inc. seminars and lots of things like that. If you're on X, the Trinity Inc. tag there you can follow, and Ross is one of our student partners who now kind of is working within the the team in the office, I suppose, of the Trinity Inc. But he's got really, really excellent sort of accessibility tips of the week. And they're very, very, as I said, quick wins, easy things that you can do that will make a big difference for the students' learning experience. So I would encourage you, some stuff might be specific to Trinity academics, but those of you that are joining us from further afield, definitely I'd encourage you even to just drop into the website and get some ideas about how you can make your curricula more accessible and more inclusive. So that's a bit of a whirlwind tour, I suppose, of some of the work that we've been doing here at Trinity and specifically in radiation therapy. So I just wanted to acknowledge my co-champion, Julie Broderick, and also as well the undergraduate medical students that have undertaken some research in this field as part of their program. So thank you very much. I think that's it.
Great. Thank you very much, Liz. I might ask you to stop sharing. Brilliant. Thanks a lot. Now, I can't see you for some reason, but maybe that's just me. I'll change my
I'm
view.
here, I promise. I haven't left.
Yes, now I see you. That's okay. I don't want to just see myself on the recording. So thanks for that. I think it was extremely informative. I wanted to start the questions while others maybe are having a think about it. About, I suppose, the difference between inclusive healthcare versus teaching in an inclusive way. I found that kind of quite interesting when you put it like that. And I'm here thinking of all the things I'm guilty of as you're going through it. Do you think that the main, maybe a better opportunity for teaching inclusive healthcare is for our not necessarily in the lecture theatre, but for our our colleagues today who are clinical radiation therapists and are involved in the clinical education of students? Do you think that that's that's a really good opportunity for people to teach inclusive healthcare?
Yeah, absolutely. I mean, I think, it's quite easy for us as academics to stand up in a lecture theatre and sort of talk about what it means. But unless you're, really working with people and hearing from people on those lived experiences, I think it's incredibly valuable. Yeah, so absolutely. And again, if you're wanting to link that back to the theory of UDL, that's another example of giving multiple means of expression and representation. So again, it's not just hearing from the academics, but it's hearing from the people that are actually working, and living in those environments. Yeah, so definitely.
Yeah, and again, I suppose just staying in the same vein, thinking about our colleagues who are teaching in the clinical environment who are listening today, because there's a lot of materials about, obviously, if you're preparing kind of formal lectures and things like that. To your knowledge, is there anything available for our clinical colleagues in terms of making sure that they're teaching in an inclusive way, not inclusive healthcare, but they're actually teaching in an inclusive way in clinical practice?
Yeah, that's a very good question. And to be honest, it's something that I haven't looked at myself, so I'm not familiar if there is. I imagine there is. It's unlikely to be specific to radiation therapy, but I'd say that we can take a lot of experience from our colleagues in nursing education. So I'd say that there is material there for them. You'll just have to kind of take it from other kind of disciplines of healthcare and apply it to radiation therapy.
That might be a little project for us, I'm thinking of here as we go through it.
One point, Michelle, as well, just to mention that I hadn't touched on at all, but it kind of follows on with what you were saying. I think as well that there's a lot of opportunity to bubble this theory over in education for patients. We've talked a lot today about education for students and how we need to provide multiple means, of material for them. But likewise, it's really important that we are providing our patients with multiple means of, ways to engage with their material. And it's not just handing them a leaflet of what radiation therapy is, but, maybe providing them with access to recorded content and things like that.
Yeah, no, that's an excellent point. And yeah, I mean, I think, you know my feelings on it, and I think we can be very presumptive when we're handing out leaflets to patients that, they're actually, that everyone can read and can understand them.
Yeah, exactly. And it's another really wonderful opportunity for us to work with the clinical colleagues again, that they're really best placed to kind of roll this out within their departments.
Yeah, absolutely. The just wondering about you know, I'm thinking about assessment and giving people different means of, you know, I know what you had shown was the activities and that people can contribute, you know, in different ways in activities. What
Mhm.
about, I'm just thinking, you know, I suppose with a bit of a regulator hat on, you know, when you provide people with multiple opportunities for delivering their, you know, giving their assessment. So
Mm.
say, you know, it's not a bog standard essay, but you can actually, you know, maybe record your essay or something like that, or
Mm.
record your contribution. How do you have any experience of that? I suppose I'm thinking about in each country where people are listening to us, the state regulator can be quite rigid, you know, in terms of
Mm.
what the assessment of students are, and they are in medicine, as we know in general. Is
Yeah.
that very difficult for people to kind of wrap their heads around, that you could actually give different assessment types but still assess the same learning outcomes? Or, you
Yeah.
know, what's your thoughts on that?
Yeah, it is absolutely. And I think that's, you know, I think other, you know, schools within the university, the humanities and things like that are able to embrace that a little bit more easily, I suppose, than us in medicine. And I think, you know, there was a concern, you know, I know in our department, there was a concern about being so free in that respect. And so
Mm,
what we have decided to do, I know, Michelle, you know this, but maybe for everyone else on the call today, the kind of approach that we have taken in our department is, whilst we can't provide students a choice in the specific assessments, what we do provide them is a variety in the assessments across the program. So that's something that we do as part of our annual curriculum review. We have a look and make sure that we're not assessing everybody in every module with an essay or an exam, but we also, you know, do in-class debates, which has been a really wonderful tool to show, you know, teamwork. Students have to work together as a team. They need to kind of critically analyze the literature. They need to know the range and the breadth of the literature as well as the depth of the topic. And they're really showcasing that through, as I said, the spoken word. So it's a kind of, you know, it's a spoken debate. And then, you know, of course, we've got more traditional assessment styles as well. So I think that's the way we've overcome that in our department. But, you know, I know, like, speaking again to colleagues in medicine, it's very clear. They're like, well, I'm sorry, it's very difficult for us to, you know, we need students to know how to take blood pressure or to do this test, or it's very clinical skills that need to be assessed. And that's something that you can't really provide in an alternative way. So it is a challenge. I recognize that. And I think just find the opportunities within your curriculum that you can provide a range as opposed to a choice.
mm. Just wondering, are you yourself and your co-champion Julie, are you considering having kind of a follow up, because you were saying that your response rate was quite poor in the first round? Are you considering having a follow up at some point to see if, as a school, I suppose, we've made any headway on this topic?
Yeah, that's something we haven't actually thought about. It would be nice. It would be a nice way to kind of show, hopefully, that the knowledge has improved with some of the initiatives that we've put in, and even just kind of broader awareness within our, you know, college community to help. So perhaps that would be something. I think the very low response rate, to be honest, is indicative of the kind of interest and motivation within this kind of field. But that being said, you know, it was kind of new at the time when we undertook that survey. And so I wasn't surprised that a lot of people just thought, oh, this is a bit weird and I don't need to know about it.
Mm-hmm.
But, as you know, as our student population continues to become more and more diverse, and we're sort of seeing these challenges and understanding the challenges that our students face, I think, you know, we can't hide from it anymore. It's not a random survey that doesn't concern us, and it is something that we need to, you know, to kind of really reflect on.
Mm. And of course, that'll translate into, you know, because students, you know, medical students, radiation therapy students, physiotherapy students become practitioners.
Mm.
So it's something that's going to be ongoing when they enter the workplace as well. Just to finish off, then there's a couple of questions in the chat from Prakash, so I'll just put them. I'll just actually put those together, Prakash, as one question, if that's okay. So I suppose in this, if one was interested in research in this topic, you know, what do you think will be, I suppose, the biggest gap, or what, you know, should someone maybe starting out in research on this topic consider?
Yeah, that's an excellent question. I think probably, like we've done, you know, if you coming from if you're coming from somebody like, if this is a question from an academic who's currently working in a, academic environment, I think the first port of call is to identify gaps in your existing kind of curriculum in terms of, strategies and things like that. So, I think what we have done within our department makes a lot of sense. I think, we've done some sort of, captured baseline knowledge and understanding, and then we have done some audits of what we're already doing, and then we've identified what needs to change. And again, when you're asking people to make big changes, it can be very, very daunting. So, just acknowledging the good work that's being done, identifying quick wins and sort of, small changes that will make a big difference, as I said, is really, really good. But I think, to be honest with you, like, there's a really wonderful opportunity if you're that way inclined. There is a paucity of data within radiation therapy education. As I said, we're using a lot of kind of nursing education and even broader medical education to make assumptions about radiation therapy, but there is a niche already there. If you're wanting to work in radiation therapy, there's a knowledge gap already in the literature.
Mm-hmm. Great. There you go, Prakash. So that can be the start of a project for you. And Robert has a question there, and this is quite interesting actually, about AI tools in radiation therapy education. And of course, we have kind of more and more coming, on stream. I'm wondering about, and I assume you're wondering too, Robert, about their use in terms of being inclusive.
Yeah, I almost feel,
difficult
Michelle,
question,
you'd be
actually.
better
Thanks,
placed to
Robert.
answer that than me. So Michelle's done a recent project with students about kind of using AI and how AI can be used in a really healthy way in the classroom. So, I mean, my initial thought is, you're right. Like, it depends on what AI program you're using and how you're using it and things like that. It can, in terms of inclusive material that it produces, it will produce text, but it can also produce images and things like that. I haven't worked with it in terms of producing, anything beyond that, but there's obviously translation, immediate sort of live translation to different languages, which could be particularly helpful. I think also as well, there's an opportunity for us to use those translation services to overcome kind of bias, which is happening already in scientific research. And, we're talking about kind of inclusive education and making sure that we're using, again, this goes back to the concept of decolonizing the curriculum and making sure that we're not just teaching very Eurocentric approaches or very kind of, westernized kind of material. And I think, there could be an opportunity there for kind of AI to help us tap into that existing evidence that we haven't been able to, simply because of language barriers or things like that.
Yeah. Great answer and great question. Thank you very much. So I think that is all the questions that we have in the chat. So, and our time is almost up. So thank you everyone for attending, and thank you, Liz, for that really fascinating talk. And I think you've given people lots of research ideas and lots of ideas for how they're teaching and things that we can we can all improve for sure.
Yeah, absolutely. And anybody is very welcome to contact me. So if you wanted to collaborate further on this, to get it going in your own local departments, I'd be more than happy to.
Brilliant. Thanks so much, Liz. Okay, so thanks everyone for attending. Have a good afternoon, evening, morning, wherever you are. And just to let you know that for next month's webinar, we're returning to the topic of risk management, and the topic will be specifically on a European Commission project called the Marlin Project, if that is of interest to you. So keep watching social media for the advertisements for that. But otherwise, thanks a lot for joining, and have a good day. Bye-bye.